A crisis that arrived without warning. Honey, I feel dizzy all of a sudden. While having his morning meal, 73-year-old John Smith dropped his chopsticks, and his words became slurred. At that moment, the strength in his right arm gave out. Thankfully, a quick trip to the hospital saved him from the worst, but the doctor gave a serious warning. Your blood vessels are very narrow. You were on the verge of a stroke. Do you think this could never happen to you? According to you, yes. Health data. The mortality rate from cerebrovascular diseases among Americans over 60 is increasing every year. But there's no need to despair. You can significantly improve your vascular health by simply and consistently eating just 3 fruits that are easy to find. Listen to today's story all the way through. You can lower your medical bills without relying on medication in hospitals. What's more, the rest of your life could be completely different. I have a small favor to ask. If you want to keep receiving more health secrets, please hit the subscribe button right now. Hitting like and subscribe is free, but your health is worth so much more. And leave the number 1 in the comments. Your single click gives me great strength to create more videos. Please share this with your loved ones too. Your experience can help a lot of people. Do you really know why your arteries get clogged? To understand how blood vessels get clogged, think of a water pipe. A new pipe lets water flow freely, but over time, rust and debris build up, and the water flow gradually weakens. Our blood vessels are the same. As we age, cholesterol and triglycerides build up on the artery walls, and the vessels become hard and lose their elasticity. This is called atherosclerosis. What's even more serious is when platelets stick to the damaged inner walls, forming blood clots. If this clot breaks off and blocks a blood vessel in the brain, it causes a stroke. If it blocks a vessel in the heart, it causes a heart attack. Arterial aging accelerates especially after the age of 60. The risk is even higher for those with high blood pressure, diabetes, or high cholesterol. Fortunately, you can significantly reduce these risks with the right diet. The first miracle fruit: apples. An apple a day keeps the doctor away. The story of David Miller and his apple. David Miller, a 69-year-old who lives in a small town in California, received shocking news during a health checkup 5 years ago. His blood pressure was high at 16/100, and his bad cholesterol LDL was double the normal level. The doctor recommended medication, but David decided to try lifestyle changes first. At that time, his son gave him a piece of advice: eat an apple every day. Though skeptical at first, David began eating 1 apple, with the skin on after his morning meal every day. 6 months later, something amazing happened. His blood pressure dropped to 14/90, and his bad cholesterol decreased by more than 20%. After 1 year, his numbers were almost back to normal. The secret behind an apple's vascular protection. Apples are great for vascular health for several reasons. The magic of pectin. Pectin, a soluble dietary fiber abundant in apples, binds to cholesterol in the intestines and helps excrete it from the body. A study of people who ate 2 apples a day for 4 weeks showed an average 16% reduction in bad cholesterol. The anti-inflammatory effect of quercetin. Quercetin, a powerful antioxidant found in apple skin, reduces inflammation in the vessel walls and inhibits the formation of blood clots. It also helps lower blood pressure, aiding in the prevention of hypertension. Potassium for blood pressure control. An apple contains about 100 millimeters of potassium per 100 grams. Potassium helps to flush out sodium, which plays a role in stabilizing blood pressure. The right way to eat apples: eat the skin. Most of the nutrients are in the skin. 1 to 2 a day is enough. Considering the sugar content, 1 to 2 apples a day is appropriate. Better in the morning. Pectin absorption is better on an empty stomach in the morning. Choose fresh ones. The nutritional content of apples can decrease with long-term storage. The second miracle: fruit blueberries, the guardian angels of your brain. The story of Linda Davis's memory recovery. Linda Davis, a 71-year-old living in Springfield, Illinois, recently found herself forgetting things more often. She couldn't find her keys and quickly forgot what her daughter-in-law had asked her to do over the phone. She worried it might be the early stages of dementia and went to the hospital. Fortunately, tests showed she did not have dementia, but her brain's blood vessels were narrowed and she had microvascular damage. The doctor told her, "You need to pay special attention to your cerebrovascular health." At that time, Her daughter recommended blueberries. Linda began eating a cup of blueberries in her yogurt every morning. 3 months later, her memory had surprisingly improved, and after 6 months, her vascular condition had also improved. The amazing effects of blueberries on your brain's arteries. Anthocyanins' protective effect on vessels. The deep purple color of blueberries comes from anthocyanin, a powerful antioxidant. Anthocyanin protects the arterial walls and increases their elasticity. It also protects the tiny blood vessels in the brain, reducing the risk of stroke. Inhibiting platelet aggregation. Blueberries prevent platelets from clumping together, which inhibits the formation of blood clots, the direct cause of strokes. Blood pressure lowering effect. A study of hypertensive patients who regularly consumed blueberries for 8 weeks showed an average reduction in systolic blood pressure of 5 to 6 mmHg. Improved brain function. The flavonoids in blueberries improve blood flow to the brain and enhance memory and cognitive function. They also help prevent dementia. Blueberry consumption guide. Daily recommended amount: 1 cup, about 140–150 grams of fresh blueberries, or 3/4 of a cup of frozen blueberries. Frozen is as good as fresh. Frozen blueberries also retain their nutrients well. Try various ways. Put them in yogurt, cereal, or smoothies, or just eat them as they are. Consistency is key. You need to eat them consistently over time, not just for a short period, to see the effects. The third miracle. Fruit pomegranates, the scavengers of your arteries. The story of how Robert Jackson reversed his arterial age. Robert Jackson, a 66-year-old who used to work in construction, was shocked after a health checkup when he retired. The doctor told him his arterial age was 80. His blood vessels were severely damaged after 40 years of stress, alcohol, smoking, and an irregular diet. An ultrasound of his carotid artery revealed that the vessel lining was thick, and there were many small plaques, arterial debris everywhere. The doctor warned him, "If you leave it like this, it wouldn't be surprising if you had a stroke at any time." Robert decided to completely change his lifestyle. In addition to quitting alcohol and smoking, he started seeking out healthy foods. Among them, he decided to eat pomegranates every day. He drank a glass of pomegranate juice blended with the seeds every day and ate the fruit as a snack. 1 year later, a re-examination showed surprising results. The thickness of his carotid artery lining had decreased, and the small plaques had almost disappeared. The doctor said, "Your arterial age has become 10 years younger." Pomegranate's mechanism for purifying arteries. Punicagrin's arterial protective effect. Punicagrin, a very powerful antioxidant in pomegranates, removes oxidized cholesterol that has built up on the arterial walls. It also protects the endothelial cells, inhibiting the progression of atherosclerosis. Nitrates' arterial expanding effect. The natural nitrates in pomegranates are converted into nitric oxide, NO, in the body, which expands the blood vessels. This lowers blood pressure and improves blood flow. Anti-inflammatory effect for vascular protection. Chronic inflammation is one of the main causes of atherosclerosis. The anti-inflammatory compounds in pomegranates reduce inflammation in the vessels, improving vascular health. Ellagic acid's clot-preventing effect. The ellagic acid in pomegranates inhibits platelet aggregation and reduces blood viscosity, which prevents blood clot formation. How to use pomegranates and precautions. Effective ways to consume. Pomegranate juice. 1 glass, about 250 ml of 100% pomegranate juice, blended with the seeds. Pomegranate fruit. About half of a medium-sized pomegranate. Pomegranate. Concentrate diluted in water, 1 to 2 spoonfuls a day. Precautions. If you have diabetes, consider the sugar content and consume in moderation. If you take blood pressure medication, consult your doctor before consuming. Pomegranates can lower blood sugar, so be careful when consuming them with blood sugar medication. The synergy of the 3 fruits. When you eat apples, blueberries, and pomegranates together, their individual effects are enhanced. Morning 1, apple with the skin on. Lunch. 1 cup of blueberries after your meal. Evening. 1 glass of pomegranate juice. If you divide your intake into 3 times a day, the vascular protective compounds will be at work in your body all day long. A guide to everyday practice. Shopping tips. Apples, choose ones with shiny, firm skin. Blueberries. Choose ones with a deep color that are plump. Frozen is also fine. Pomegranates. Heavy ones with thin skin have more juice. Ways to use them. Apples. In salads, smoothies, or eaten on their own. Blueberries with yogurt, cereal, or in muffins. Pomegranates in juice. As a salad topping, or eaten on their own.